This is what I recommend for my patients after plastic surgery for scar care. I'm a fan of using scar tape after plastic surgery to help reinforce incisions and try and prevent some of the scar widening that can happen over time. Let's talk about this in a little more detail. So, when is the right time to start? Well, that's patient dependent, and that should be something you discuss with your surgeon. For me and my patients, typically it's once all the scabs or any acne that's around the incisions has resolved, and we can now cover that area with tape. The tape that I recommend using is a silicone-based scar tape. The reason I like the silicone is just that you can leave it on the skin and you can still take showers. You can sweat in a gym and it'll still stay in place. Then it's just less on and off tearing over time compared to, say, if you use like a paper tape, which can get wet and come off, etc. You have to then constantly reapply tape to the same area and your skin can get irritated. So I think a silicone tape is a little bit better for that purpose. So how to apply the tape and where to apply the tape? Well, I have this tape here which has a non-sticky backing, and this allows you to pre-measure your areas where you're going to apply it. Typically this is, and I'll use an example for a breast lift with an anchor incision. So what I would do is I would pre-measure, usually the side like this, under no tension. This tape has perforation, so it's easy just to tear. You could also cut it if you'd like. Then you're going to peel off the tape from the backing. And this is important. When you apply it, you don't want to apply it under tension and stretch like this. Okay, if you do that, especially with swelling in the breast and tissue, you'll end up getting blisters. Oftentimes people will consider that an allergy to the tape, which it really usually isn't. In my opinion, it's more of a mechanical stretch and shear reaction from putting this tape on too tight with it swollen. So we just want to apply the tape gently right in line with the incision, so it overlaps on either side of the scar. Then you can pre-measure and trim your other side, something like that. And peel and apply. Boop. Okay. Then you would do the same thing with the vertical scar, and you can actually do a little, usually a triangle around the areola. They also make some that are more of a donut shape. They're pre-cut with a little center cutout for the nipple, and then you can just apply that right over and around the nipple. It just makes it easier, but it's probably more expensive. And initially, when we first start the tape, we're gonna do a trial. So you're gonna leave it on for 2 days at a time, okay? And when you take it off, you can inspect the area and make sure that it's not being irritated, there aren't any red areas, you're not getting blisters, you're not covering acne. And if those things are all true, you can shower and then reapply the tape. Now you can use the tape for 3 days at a time. Okay, just change it every third day. It just makes it a little bit easier, less taxing to do it. For my patients, I recommend trying to do 4 months of taping. If we're changing every 3 days, that's really not a whole lot of taping. And that's my scar regimen for cosmetic plastic surgery incisions in my practice for my patients. If you have any questions or you found this to be helpful, drop us a line and we'll be in touch.